This is Patrick, a young man who recently moved out of his parents' home. He has a good job, is single, and is excited to exercise his newfound freedom. Like many others in his search for a wife, he has drinks with his friends, meets women, and even becomes serious with a few. He has heard about the risk of HIV and how it can only be passed a few ways, through blood, semen, vaginal and rectal fluids, and breast milk, and thus only has protected sex, with one exception. One night, Patrick goes out with his friends and meets a beautiful woman. He has a one-night stand, but he did not come prepared. He figures it will be fine. After all, it is only one time, and for years afterwards, he thinks he's correct. He is in perfect health, and although he does occasionally feel under the weather, he figures it is just stress from his job, so he never bothers to get tested for HIV. Eventually, Patrick falls in love and marries the love of his life. Only a few weeks after their wedding night, his new wife comes down with a bad cold and goes to the medical clinic just to be safe. She tests HIV positive. Patrick had passed the virus on to his wife without even being aware he had it. Patrick is not alone in his experience. In fact, in Rwanda, 64% of new HIV infections occur in stable relationships. Little did Patrick know, someone can have HIV for years without presenting any symptoms. HIV, or human immunodeficiency virus, presents in 3 stages. The first is called acute HIV infection, which occurs in the first month of exposure. It commonly presents like the flu, with muscle and joint pains, tiredness, and a fever. But some, like Patrick, never show any symptoms at all. The second stage, called clinical latency, can last 10 years or longer without any treatment whatsoever. During this time, the virus is still present, but at very low levels. The final and most well-known stage is AIDS, at which point the immune system has been damaged and risk of both cancer and infection is much higher. There is a high risk of HIV being transmitted at any point during the 3 stages. The best treatment currently is antiretrovirals, or ARVs. These medications can make the virus undetectable and therefore non-contagious, so long as they are taken daily. Missing one dose can allow someone to pass on the virus. The most tragic part of Patrick's story is that if he had been tested, he could have still lived a full life with his loving wife without ever passing HIV onto her and putting any children they may have at risk as well. Here in Rwanda, both the test and antiretroviral treatments are free for all. Although they never would have been cured, once Patrick and his wife knew about their infections, they were able to start daily treatment, more than tripling their lifespan and decreasing the risk of passing on HIV to any others. Easy. Quick. Safe. Don't take the risk. Get tested today.